you have done it already. Let me see. Okay, no, Dr. Anjali is writing no. Okay. So those of you who have done it, never mind if you have not done it, we will discuss what are the components of a qualitative research protocol. And if you are doing mixed method, maybe the qualitative part you can write and then quantitative you can write separately. So we'll start what should be the part, and we have shared the draft protocol also with you people. So that's a very huge, like it's a 46-page document where we have explained also all the terms. Probably that's why it is a very huge. I will also share one protocol which we have shared here in the ethical committee. So that was on HIV, co-infection, HIV and visceral leishmaniasis, the quality of visceral leishmaniasis. And in Bihar, there's a problem of visceral leishmaniasis. So there are many patients who have got co-infection with this HIV and visceral leishmaniasis. So we conducted a study in 2018 to see the quality of life in these patients, because they were neither they were getting the treatment for HIV, and like if they were getting the treatment for leishmaniasis, that HIV part was ignored. So the disease got advanced. So we'll share that protocol also. So coming to this research problem, so if you have some research problem in your mind, how do you start? So let's say this is because we are discussing this research question, like what are the perceived barriers to effective communication among healthcare workers in managing chronic disease in a tertiary hospital setting? So first, we need to select appropriate research design. So what are the research design? So basically, this research design is dependent on the type of worldview which we have discussed. What are worldview assumptions? What are our strategies? That means procedure of inquiry, and what are the specific methods of data collection? So like we have discussed, if you only want to know about the burden of this problem, or do you want to know about the reasons of this problem, or do you want to know both reasons as well as burden? So if you only want to know about the burden, you are a quantitative researcher, your research paradigm is that of a positivist paradigm. If you are if you are interested only in understanding the reasons of this, then it is a constructivism. You are a constructivist, and the research paradigm is that of a constructivism. And if you are thinking that this reality is changing and it needs to be reinterpreted every time, then you are a believer of mixed method. Then you should go for this mixed method. So again, what strategies or inquiry you should do if you want to know the burden of the problem? You can do a cross-sectional or a longitudinal. If you want to know the reasons, you can do a narrative or a phenomenology. Or if you want to know the burden, you can do a narrative cross-sectional or a cross-sectional and this thing, phenomenology. So regarding the method of data collection, if you are a quantitative researcher, the method of data collection will be the survey or record-based, means secondary data collection. Secondary data analysis, if you want to know the reasons of this problem, then it will be a data collection method will be the participant observation, interview, and focus group discussion. And if you want to know the burden as well as reason, then it will be a mix of two. So in all these 3-4 cases, we have seen like what should be our method of data collection, what should be our research paradigm, and what should be our worldview. So generally in any qualitative research proposal, there are 3 sections. So there is an introduction, there is a review of literature, and then there is a methodology. So we'll start with this introduction. So there are few key points for introduction, and it is a very important part of your qualitative research proposal. So you give the background of your problem, you give the means background of your research question, you give the problem, and then you start with the significance of your question. And then you write the purpose of your study. We'll discuss these one by one. And then you write about your reasons, You give the definition of terms. This is very important. You should define the terms which you are using in your qualitative study. You write the limit assumptions of your paradigm, and you also write some limitations, and you write the delimitations also. We'll discuss the difference between limitations and delimitations, and then you write the conclusion. So these are the 10 sections of your introduction. So coming to the first point, that is your background and the problem statement. So yes, can someone read this paragraph?
Despite
Despite despite the availability of communication tools, healthcare workers in tertiary hospitals often struggle with effective patient communication, especially in managing chronic diseases. Factors such as language barriers, time constraints, and low health literacy contribute to this issue, affecting patient outcomes and adherence to treatment. Exploring these barriers will help improve communication strategies, leading to better patient care and outcomes.
Thank you, Dr. Ajay. So you can see here that that part which is there in the yellow highlighted part, here the author is or the researcher is trying to give you the background. So background is like he is telling that there are communication tools, but still if you see like healthcare worker, they struggle with effective patient communication because follow-up is not that good, and they leave medications in between, and they again land up with stroke or some other problem. So with this background, he's starting with the problem. So the problem which he has identified, that he is describing that the language barrier, the time constraint, and low health literacy, that is contributing to this issue. And then in the third sentence, he is telling you regarding significance. Like if you explore these barriers, or if you explore these problems, what help it is going to do. So these three sections, like background, problem, and significance, these three should be there. And in the like we have said, the background is about starting the context of your research question, and the problem is like what problem the health workers are facing. And then significance is like if you explore your study, if you explore these barriers, what help it is going to give. So this three constitutes your problem statement: background, problem, and significance. So like in this case, this is one problem statement where the despite, yes, can someone read this? Then again, we'll dissect.
Despite the availability of iron and folic acid tablets for pregnant women in the district, consumption remains alarmingly low. This is particularly concerning as IFA is essential for preventing anemia and related complications during pregnancy. Health officials are worried that the low intake of IFA tablets is contributing to serious maternal and neonatal health outcomes, including postpartum hemorrhage, low birth weight, and intrauterine growth retardation. Addressing this issue is critical to improving maternal health and birth outcomes in the district.
Yes, thank you. So we can see that what is the background here? So background is basically the first part. Like despite the availability of the iron folic acid, then the second, if you see this, the second one, like this is concerning, it is not visible here. Yeah, so this is concerning the second part, like this is particularly concerning as it is essential for preventing anemia, and health officials are worried that low intake of IFA tablet. That is your problem statement. And the third one is like if you addressing this issue, the last sentence, addressing this issue is critical to improve the maternal health and the birth outcome in the district. That is the significance. So all these three makes the problem statement. So from problem statement, you go to the purpose statement. So now what is the purpose statement? Once you have told your problem statement, then you say about what is the purpose of the study. So it starts with this framework. The purpose statement, you tell about the central phenomena. So what is a central phenomena? Basically, central phenomena is the central theme, which like in this case, doctor-patient communication or the communication barrier is my central phenomena. Then comes your, you should commit about the participants also. You should also tell in the purpose statement regarding the study site also, in which site you are going to do the study. Then you mention about the whatever word like purpose or the intent of the study, you should start with these words. And then it should contain words like also understand, describe, and develop, the way we describe the objectives, those action words. So the action words in the purpose statement should have something like understand, describe, or develop. And then it should have a neutral or a non-directional language. For example, I can write that the purpose of this study is to understand why healthcare workers face barrier. So I have this word like purpose, because in purpose statement, you should give this word purpose. Again, this word is also there, understand. So the purpose of this study is to understand why healthcare workers face barriers in effective communication. So this line marked with red is my central phenomena with the patients in tertiary care hospital setting. So I am mentioned the setting also, and in managing chronic disease. So central phenomena is the core idea, which we are trying to explore in the qualitative study. And this is a one suggested script for writing a qualitative purpose statement. Like here also it is showing you that it is writing that purpose of this, and then you have to write qualitative approach. Like let's say if you are doing a qualitative descriptive, you will write that the purpose of this qualitative descriptive study is to understand or to explore or to describe. They have given these words also here. If you see like understand, describe, develop, discover, and then it also gives you like effective patient communication. If that is my central phenomena that you have to mention here. For means the participants. So like you have to mention this, and then the research site, tertiary care hospital or in a primary health care center that you have to write. And you have to define the central phenomena also. But at this stage, this central phenomena is defined by giving a general definition. Like, again, it's written that the purpose of this qualitative study was to generate a theoretical model that explores what low-income rural families, which is a research site, with young children do for acute health event. So here my acute health event is a central phenomena from the perspective of mothers. So mothers are my participant. So what is missing here? If you can recall that previous slide, what is missing here in in this purpose statement? So here we have not given. Yes, can someone write it here? Approach. Okay, approach. Yes, and here he has not mentioned the definition. What does he mean by the yes about the acute event? Dr. Arun is right. The definition of the event he has not mentioned. Similarly, what is missing here? Again, can someone read this? Can someone read this purpose statement?
The purpose of this multi-site qualitative case study, that is qualitative approach, is to explore the action of how adolescents, that is the participants, talk about tobacco use, which is a central phenomenon in their schools and in their lives. It is a research site.
So what is missing here? Thank you, Dr. Rini. Yes, what is missing here? Again, the definition of explore what he has written like about tobacco use. So, but he has not like tobacco use. How does he define tobacco use? Last 1 year or last 6 months or last 1 month? Yes, the central definition of central phenomena. So we have defined the problem statement, we have defined the purpose statement. Now comes the research question. So research question, basically, generally you have to have some research questions. So there are basically two types of research questions. There is a central question and there are sub questions related to that. So in this case, like central question is one broad question. And generally it begins with word like how, the three words like how, what, how, and why. But again, like we have discussed that, like typically it should not begin with the word why, because again, this why says that cause and effect language, and it hampers the initial rapport building. So when you are comfortable with the clients or the beneficiary or the patients, then you can start with the getting the answers for these why questions. Otherwise, initially you should start with what, how, and then why. So it should, all the research question, it should begin with these three words: what, how, and why. Like here you can see ideal order of a central research, this question. So how and what, here you can see the first is what or how. Central phenomena means it will be like, in this case, if acute health event or effective patient communication or communication barrier, then you have to describe about, say about the participant, and then about the site, in which site you are doing this. Like this is one question: how the newly joined MBBS students adjust at AIMS Patna. Again, you can improve this question. Like if I frame this question like, what are the coping strategies that the first year MBBS students are using to adjust in the first year of AIMS Patna? This is just few examples which are here. Of course, it will be different in all cases, like in your case. And then there are sub questions related to these central phenomena. So these sub questions helps you in formulation of. So because central question is a very broad one, and then you divide into many sub questions which will form the core content for an interview or observation. Like in this case, if I ask this question, what does it mean to be like a medical college professor? If I ask this question, then of course in medical college professor, you have got various role. So you can ask like role to be a professor in classroom. How, what does it mean to be a professor as a researcher, as a thesis supervisor, and in a social life? So you have just delineated the various roles. So the one broad question will have many sub questions, and these sub questions help you to have a more probe whenever you go. So here, if I, it is not something like inductive or deductive, but using this approach, you are a kind of making this a little deductive in nature. Dr. Anjali, if you are here. So we've discussed in the initial, during the basic concepts like inductive versus deductive. So here, if you review the literature thoroughly, and if you can formulate these questions, then your interview guide will be more of a deductive. Of course, in between, the inductive things will come, because if somebody is answering something which is not their interview guide, definitely you will explore those concepts also. But you are starting with something which is more of a deductive in nature, and then you go in the field with this deductive framework, but you are open to the newer inquiry also. So it's a kind of mix. And since you have already worked on your research question, you have seen the literature, and you have worked on your research questions and what will be the sub questions. So you are clear on to what you have to probe, because it is different from quantitative, because in quantitative it is structured. But here we always say it is a open-ended, and it is a kind of like very much open and flexible guide, because a qualitative interview guide is not a watertight compartment. It's very flexible. But again, you go with some framework, some deductive one. Again, this is example of one central questions and expected sub questions. Like if one central question is how persons living with AIDS represent and image their disease status. So the sub questions can be, what does receiving an AIDS diagnosis represent? Or what is difficult or easy about being diagnosed with AIDS, or how they have first become aware about their diagnosis, etc. So these are some other examples. So sub questions, it narrows down the central question. And you should write few sub questions so that you can probe the person on those sub questions. And while you are making these questions, like we discussed, there is a phenomena which is known as the bracketing. Now, what is a bracketing? So this is a quote by Jiddu Krishnamurti, and he's a famous spiritual guru. And he just wrote that the mind has to be empty to see clearly. So since we were talking regarding the reflexivity and regarding the biases, so in bracketing, we should suspend our judgment. And whatever is our prior experience or image, we should keep it aside and we should keep empty our minds before, and we should try not to put any preconceived notion or not to put any prior image or our bad experiences, and try to pick only those sentiments and those patterns which are similar to our experiences. So that's how a researcher should do bracketing whenever they collect or whenever they analyze the data. And this bracketing starts after accepting your biases, because it is very hard for someone to accept biases. All of us are not very open to accept our own biases. So that's why this bracketing starts the moment you accept your limitations. The bracketing starts. And then while doing analysis also, if you are just keeping this fact into your mind that yes, you may be biased, you have to be very cautious, then to some extent you can definitely limit this biasness of your research finding by practicing this bracketing. So to summarize, you start with the background of your research, you give the problem, and then you give the purpose statement, you give the research question, and then you give the meaning of those terms, like what are the definitions. Assumptions, you write that what you have to go by whatever participant is saying. So you cannot verify it. So that is the assumption. And the limitations are like if you are doing it in a particular setting, then it is the limitations. And delimitation is like which author actively puts into the research. Like if I'm doing something in my hospital, of course, that the setting I chose deliberately, you cannot apply it to all the setting. So that is the research. I have actively put that limitation. So that is the delimitation, and then I have to summarize my this whole introduction. So this was regarding the introduction. Coming to the second part, the review of literature. In review of literature of a qualitative research, this is not very extensive as compared to your quantitative research, but it depends. And also, like if you see those reference books, I think we will put one snapshot of all those reference books for your ease towards the end. Not now, because I have not put those snapshots, but again tomorrow, the beginning slide I'll put. So review of literature, yes, if you see the Terrell, that is also a reference book which we have used, taking this protocol. So they suggest making a literature map. So this review, it starts often as a small part, and then it helps to understand the background problem. But it can be a standalone review also. Sometimes you will see that not much work has been done. So your review of literature may be very small. So you have to create an outline, and you have to ensure the trust. We will discuss this trustworthiness and validity also regarding the literature which is there. And trustworthy source means you have to see regarding the impact factor of the journal, because the qualitative research also these days you will see that a lot of journals are a predator journals, and everything gets published, whatever you have written. So if you are just writing it in your reference, you have to see like whether it has come from a trustworthy source, and does it reflect the valid research or not. So whenever you are doing the review of literature, you should see the difference between the primary and secondary source. You should see the journal impact factor. And again, you should remember this sentence, like just because something is published, it doesn't mean that it is valid. So most important, whatever you do the literature search, you should like highlight and annotate and save it, the relevant part, because it will help you in writing the discussion. You can use a PDF reader also these days. What generally we do, like we highlight that section, and in PDF reader, you can import those sections, and that you can, while you are writing the discussion or while you are writing the review, you can give the reference of those particular quotes, because in quantitative what we do, we refer to the figures like this many percentages or these many this thing, but in qualitative it's the data quote or verbatim, or the theme or the category of the participants with the particular theme. So that will help if you annotate, or if you like highlight these sections and extract it separately, like we export it in a file separately, article wise, then it helps you in writing the discussion. So like I was saying, you can map the literature review. Like this was one example which was given in the book, that he has given the example of why young females do not accept technology as readily as young males. So he has, with the review of literature, because when you are reviewing a literature, you also see a lot of factors. So if you make a literature map, something like that, like these factors, there are home environment, there are socioeconomic status, which leads to this gender differences in the interest in technology, there are learning styles, there are intrinsic motivation and self-efficacy. So through literature search, you have got many factors, and then you will develop your interview guide. So again, this is more like a deductive framework, because you are starting your interview guide with some framework. You have got some framework, maybe a theoretical framework traditionally, but you have got some framework. This we can say like it is not exactly deductive, but yes, you have got a framework and you are using this as a method of interviewing. So through literature search, you make your interview guide, you make a literature map, and then you will make questions using these literature map. So am I making myself clear or not? Are you guys with me?
Yes, ma'am.
Okay, thank you. So again, this literature review should also include the review of research methods, means what type of like grounded theory or descriptive, and what tools they have used, whether they have used the participants' observation or interview, one in-depth interview or FGD. So we have done the introduction and review. Come next is the methodology. So methodology, again, like we have seen all those methodology, the type of research methods, which has got these are the components. It is there in the CoreQ checklist also. We will discuss again this once we go in how to report it. So you have got what is the paradigm, the world view. You are a interpretivist or constructivist, or you are a positivist, or you are a pragmatist. Research design, you have to mention. Design means, are you going for the qualitative, descriptive, or phenomenology, or you are going for grounded theory? You tell about the participants, how sampling, what sampling technique you are going to apply. Then you mention about your instrument, that is the data collection. Interview guide, you have to write about your interview guide. You have to write about the research procedure. What is the plan of data analysis? Which software are you going to use? How many coders, whether there will be agreement between coders or not, what are the ethical considerations. These part we will discuss more when we'll do the analysis part, and then how you plan to present your result and summary. So this was regarding the protocol, how to draft the protocol. Now coming to another this thing, which is the, so let me see, we are now on to interview guide. So developing an interview guide.